We're not inserting the NG tube, so we don't have to worry about that one. Okay, so we have metatarsal 6/21/1988. She has no known allergies. We have irrigation of the NG tube per protocol. We have digoxin 0.25 milligrams PO daily per NG tube. Javity 150 milliliter bolus per NG tube, Q4 hours while awake for supplemental feeding. Erythromycin liquid 500 milligrams per day per the NG tube. So those are the NG tube orders that we are looking at. Now with the irrigation, you always give free water, and it's not on the order sheet. Normally it would be on the physician's order sheet. So we're going to give 100 milliliters of water. You always want to give your patients free water because otherwise they get dehydrated, and you don't want that to happen. So we're going to go ahead and we're going to pull up the MAR. What am I looking for on the MAR? What'd you say? I'm sorry. What am I looking for on the MAR? I'm pulling up the MAR. Why do I need it?
You need to verify the medication.
Exactly. So we have metatarsal 6/21/1988, no known allergies, no known allergies. So then I'm going to go down here to the digoxin 0.25 milligrams PO daily per NG tube, digoxin 0.25 milligrams per NG tube at 8 o'clock. Javity 150 milliliter bolus. Now keep in mind that some places where I used to work, it was not on the MAR. It was considered a diet, so that you would find it on the diet orders. So we would still verify the order that, you know, we needed to do that, but it was not on the MAR, so we didn't chart it on the MAR. You would chart this on the intake and output. So INO form is how you would document that. And then any problems, of course, in a nurse's note. So we're going to go ahead and do it. So Javity 150 milliliter bolus per NG tube, Q4 hours while awake for supplemental feeding. Javity 150 milliliter bolus, Q4 hours while awake for supplemental feeding, NG tube 8, 12, 16, and 2000. So we have erythromycin liquid 500 milligrams daily per NG tube, erythromycin liquid 500 milligrams daily per NG tube at 8 o'clock. So we verified all our meds. Now remember, only if it's a first time order do you need to compare the orders to the MAR. But we're pretending pretty well here today, so we're going to go ahead and do that. So next I would take this into my patient's room, or into the nurse server, wherever I'm going to get the medications, right? So what am I going to do first? I want to make sure I have everything that I need. And you could tear off a couple labels, remember, or if you're going to put the medication, because you're going to use plastic for this one. So I would go ahead, just tear off a couple labels, put the medication name, put the amount, put the route, put the date, time, and your initials. So somebody repeat what I just said.
Name, route, date, time, initials, medication.
Medication name. Okay, right. So the medication name, the amount, date, time, and your initials. How come you're not putting the patient's name on there?
It's on the label.
Because it's a label. It's already got that information on there. So you're going to have something to be able to compare it to. So just grab two labels or so. You can even grab labels. We'll probably pre-label these so you guys, just to help save time. And when I'm doing your checkoff, I want all the labels done before you come up. So
Okay.
that way we can do that. But we'll go ahead. You'll need at least 2 of these. One for the feeding, or one for the water. So what we're going to do is we're going to do our first med check. So we're outside the room, we're doing our first med check. So we have metatarsal, and we'll pretend like the name is on here. It will come up from kitchen with it on. So metatarsal, 6/21/1988, no known allergies. This is Javity. I have to look for the Javity order. Javity 150 milliliter bolus. It's a 1.5 kilocal is what we're getting. Normally that will also be on your order as well. And we're going to check, make sure it's not expired and this hasn't been contaminated at all. Now sometimes they'll open one of these and they won't necessarily use the entire Javity. So what they'll do is they'll put that in their refrigerator. If you do that, you need to make sure you date, time, and initial this so they know when it was opened. So we'll put that aside. So we've done our first med check on there, right? So then we're going to go to our next one. We're going to do digoxin 0.25 milligrams per tablet. We have digoxin 0.25 milligrams per tablet, expires 4/20/20. And this is for metatarsal, and date of birth 6/21/1988, metatarsal 6/21/1988. So we could take one of these out and put it in one of our containers. We can go ahead and get our label, put it on there, and make sure, so that way we can do it when we do our second med check, we'll have everything labeled. So then the next thing we have is, we have our erythromycin, right? So we have erythromycin, liquid 500 milligrams daily for metatarsal, 6/21/88, no known allergies. metatarsal, date of birth 6/21/1988. This is 500 milligrams per milliliter, expiration date 6/20/25. So this is not expired. It looks pretty intact. I'm not noticing anything funny. It's kind of hard to see through this. It's a dark bottle. So then, how much do I need to take out of here? One milliliter. So one of the things that we have to keep in mind is that we're gonna have to put extra water in here. So then, I want somebody to drop 1 milliliter for me. So what would you do?
Well, I would drop 2 of them.
Yep. So go ahead and put it in that cup.
So you want to draw it up again, or you?
Yep. Keep in mind, some of them actually have 1 full milliliter in there. So we're going to half, and we're taking out. So then we would take our prepared label and go ahead and stick it on the cup. Okay. Awesome. So I would have brought in some free water, or I would get some free water. Again, you're gonna make sure you need to tally everything up on your I&O.
And we're just giving them free water out of the sink?
Yeah. Mm-hmm. 500 milliliters in here. Probably won't use all 500, but if there becomes a problem with the Alright, that's 500. So then what I would do is I'd go ahead and put extra water in here, anywhere between 20 and 30. So I've got this labeled, but I still want to prepare this medication. So what I would do with this medication is I would crush this, and you guys will get practice at that. Do we have a crusher? Do we have the other one?
Oh, I have it in here. It's where it is. I can check those. You want the one you like this?
Yep, the paper cups. You can use this is not a problem, but you need to make sure that you get all of it out and put it into your cup. I'm looking for the other one. Oh, here it is. So what you're going to do, we all have our favorites, right? I am no exception. So you're going to take 1 cup, you're going to put it in there like that. I always verify everything like 100,000 times. So, Digoxin 0.25 milligrams, so it's the right one for metatarsal. You're going to go ahead and put it in the cup. There's 2 of them sitting right back there.
Oh, by the mess over here? Okay.
Then you're going to crush this. And I think this one doesn't mix very well, so we'll pretend like it did. We're good at pretending. So we're going to go ahead and take this out of the cup. Make sure none of it stuck to the bottom of the opposite cup, and this did not crush very well. Maybe it was off to the side. Much better. So again, we're going to make sure that nothing is stuck to the bottom of the cup. And then we will pour this into our cup. So we're going to use our free water again. And pour it into it. Again, 20 to 30 milliliters. And then I would take a stir stick. Do we have a stir stick?
I don't know what you want this year with that.
Q-tip? I'll use a Q-tip. Awesome. Then you go ahead and you stir, making sure it's mixed well. And then of course your label is on it. You've already done that. guys will get even your favorite cylinders. This one's my favorite because guess what? I can actually read it. This one is much harder to read because it blends in with the plastic. So we're gonna pretend like we put the Jevity in here. How many milliliters is the Jevity? That's exactly the right answer. If you didn't remember, you look on your mark. So it's a 150 milliliter bolus. So I have 150 milliliter in here. I'll put my label on here so we know what it is. And you can even put a label on here and say how much free water you have in here. It's absolutely fine. So I need to do my second med check. I'm gonna get this stuff. And you will find out there's never enough room. Throw that away because you always clean up your area. So I'm taking my MAR. I have my Jevity, so I have metatarsal 62188. I have no known allergies. This is my Jevity 150 milliliter bolus. And then I check my packaging because you always want to double check to make sure you've got the right stuff in there. And I should have saved my niacin label. But I still have my packaging here, so I'll use that. So this is erythromycin, or not erythromycin, this is digoxin. So I have the metatarsal 62188. 0.25 milligrams of digoxin, and then I do the same thing here, metatarsal 621 1988, no known allergies. This is digoxin 0.25 milligrams, digoxin 0.25 milligrams. Now I can do my erythromycin. So checking on my label here, metatarsal, metatarsal 62188, 62188, no known allergies. I have my erythromycin liquid. I have 500 milligrams per day. I got it out of here. 500 milligrams per milliliter. I put 1 milliliter in there. Seems repetitive, doesn't it? But we have to do it to make sure it's safe. So I've got the right medications. This would all get put away in your patient's drawer, and then you're going to be taking your free water in, you're going to be taking your digoxin in, your erythromycin, and your Jevity into your patient's room. So as we walk into the patient's room, I'm just going to leave it there. We're going to pretend like we brought it in. First thing you need to do is what? You guys should be used to this. PS Love. Then what are you going to do?
Check the patient's name, ask the patient for name and date of birth.
Hand hygiene. My name is Chris. I'm going to be your nurse today. Can you tell me your name and your date of birth? Comparing it to the MAR, metatarsal 621 1988, metatarsal 621 1988. Do you have any allergies to any medications? No, I do not. All right, so what is the next thing that we're going to do?
Explain what you're going to be doing.
I have your tube feeding and I have your medications that I'm going to be giving you. You guys know about these medications. You know about digoxin. You know about erythromycin. Remember I said you had to have your medication sheets ready for Friday. You already have digoxin done. What is it and what do we need to do?
We need to assess the
Apical pulse per minute.
before administering, making sure it's above 60 beats per minute.
Exactly. So we are always looking for side effects to know what the side effects are. You already know what those are. So we would go ahead and when we do our assessment, we're going to do that. Erythromycin is an antibiotic, so we're always assessing for signs of any GI upset, so any type of diarrhea. Patients can have side effects of just minor diarrhea to massive diarrhea. If they had massive diarrhea, we need to report that to the physician and let him know that. And even for the tube feeding, you can have diarrhea related to the tube feeding, so you might have to add fiber. And you guys will get that when you do your NG, or enteral feeding, so. All right, so what we're gonna do first, I identified our patient's name to their MAR, so we got that done, but we still need to do our third med check, right? We've done our first, we've done our second, but we still need to do our third. But I need to do some assessment. So, let's see. On this particular one, if she's still hooked up to the NG tube, and the only reason that she would be hooked up is if she is, normally when they're tube feeding, they don't have them hooked up to the NG to suction. But if she was hooked up to suction, we don't even have our regulator.
Right
Okay.
Brand new.
We would check our regulator, and what we're checking for is if she's supposed to be on low intermittent suction, we're making sure that that works. So we start with the far wall when we do our assessment.
You want me to hook it up?
Sure, and if she is hooked up, that would be hooked up to her NG tube when you walk in the room. So she's gonna disconnect that, and normally you would see this all hooked up. And you might even see a chucks underneath, because in case it would get disconnected, then it would be a huge mess all over the place. So this would be hooked up to your regulator. You wanna